Welcome to Anti-Aging Insights, where age is a state of mind and aging is a treatable condition. And now, here is your host, Dr. Teri Fisher.
Hey there, welcome to this episode of the podcast. Today we are speaking all about lips, and in particular, lip filler and the different types of techniques that we can use to achieve different looks. So if you are interested in lip filler, or you know somebody that might be interested in lip filler, this episode is for you. We're diving deep into this really popular treatment. And it's interesting, there's been a lot of interest around lip filler treatments, and trends tend to come and go when it comes to lip fillers. And what I wanted to do today was really highlight some of the different techniques, some of the different looks, and some of the names of the different types of lips that you might see on social media or just when you're out and about. So let's start with the basics. Lip fillers are injectable treatments that are designed to add volume, shape, and definition to the lips. The most common type of lip filler that is used is hyaluronic acid. That is a substance that is naturally found in your skin, and it helps to keep skin hydrated and plump. In particular, it helps to keep the lips hydrated and plump. But hyaluronic acid is actually found throughout your skin. It's even found in joints in various places in the body. The benefit of hyaluronic acid fillers is that they are reversible if for some reason you don't like what was done. Meaning if you're not happy with the results, it can be adjusted, it can be dissolved. Hopefully that's not an issue, but that is one of the benefits of hyaluronic acid, is that it can be dissolved if need be, as long as you're not allergic to bees, because the type of medication that we use to dissolve lip filler is hyaluronidase, and those that are allergic to bees can have a reaction, which is why it's also very important to let your injector know if you do have an allergy to bees, particularly if you're anaphylactic to bees. So when it comes to lips, just going over a little bit of the anatomy, there is, of course, the upper lip, there is the lower lip. Generally speaking, the upper to lower lip ratio in terms of size is about 1 to 1.6. So generally speaking, the upper lip is smaller than the lower lip. Of course, in the upper lip, we have the philtrum, which are the two areas that run up towards the nose. And in between that, we have the bow shape, often referred to as the Cupid's bow. Now, when it comes to having lip filler treatments, the anatomy of the lip is very important because this also helps to determine which part of the lip we want to accentuate and what is the goal with the treatment. To give you an example now of some of the different types of techniques that we can use a vertical strut type of technique. This involves injecting the filler in vertical lines, whether it's from the top for the top lip or from the bottom for the bottom lip. And what this helps to do is give volume, number one, but it also helps to give a little bit of height because we are literally creating, in addition to the volume itself, we're creating this architecture of struts to help support the lip. So if you're looking for more volume and more height to your lip in particular, this may be one technique that an injector may use. There's also the horizontal technique where the needle comes in from the side, and that can create a more full lip, not necessarily adding to the height. This horizontal type of technique can also be expanded to include a fanning technique. This looks like one needle entry point coming in, but then the needle is moved in about 3 different places, and it creates a fanning effect of the filler. And this also is a very nice way to achieve a volumized look in the lips. Now, there's also a type of technique that we can use when we want to really add some definition to the border of a lip. The border of the lip, where it goes from pink to white, is known as the vermilion border, and that's, of course, on the top and the bottom lip. And what we can do is we can put the needle just inside the vermilion border. That means just inside the pink part of the lip, and do linear threads of filler along that border. That helps to accentuate that border and really create some nice definition for the lips. Again, if that's what you're going for, this is a really, really nice way to achieve that. Now, when you combine these different techniques, depending on what you choose to do, you can actually have different outcomes with the type of lip that you want to achieve. A very well-known type of lip is known as the Russian lip, and this gets its name from the appearance of the lips on Russian dolls. Essentially, what this is doing is accentuating the Cupid's bow. So we want to make that Cupid's bow much more pronounced, and then adding some volume to the bottom lip more towards the middle of the lip. So you end up with this heart-shaped lip, starting from the top, extending up to the philtrum, throughout the Cupid's bow, and then down to the more volumized center of the bottom lip. And this really brings some nice volume to the central portion of both the top and the bottom lips. That is a very, very common type of lip treatment that many people are asking for. Another type of request that I get, and in fact, it probably is the most common request that I get, is just simply a little bit more volume in the lip. When this is the request, typically I will use some horizontal fanning, I will use some vertical struts, and I will also look at the lip and see where do we need some more volume to make it as symmetrical as possible. Having said that, it's really important to note that we can never get 100% symmetry. Nobody is symmetrical to begin with, and we certainly can't achieve 100% symmetry with treatments. We can do our best and we can come close, but when we start to chase the symmetry, for example, if we put a little bit of filler in the right side of the upper lip and then realize, oh, we need a little bit more filler in the left side of the upper lip, we may do that. And now all of a sudden the left one looks a little bigger. We need to go back to the right side. And if we continue to do that, eventually you end up with overfilled lips. So that is not something that we try to do. And it's very important that the injector has a good understanding of when to attempt to address some of the asymmetry and when that is not a realistic expectation, and when we need to essentially back off and stop and be happy with what we have done. Now, of course, choosing the right technique isn't just about the method, it's about customizing the approach to the unique anatomy. So some patients may come in and say, I want this particular lip, and we look at the lip and we say, well, maybe there's not enough volume to begin with to achieve what you want in one setting. Maybe we need to do this in a couple of settings. Maybe we need to add a little bit of volume now and a little bit more volume in a month. And that's something that can also be very important. So I think it's really important to have a talk with the injector about what it is that you want to do with your lips, what it is that is achievable in the first session, and perhaps this is something that will take a little bit of time. The other thing to be aware with lip treatments is that swelling and bruising are very common. And so oftentimes when you leave the chair, lips look a little bit more swollen than they will after that swelling settles down. So some people love the volume of the lips that they have when they leave the chair. And we have to tell people that, you know what, they're actually going to be a little bit smaller than what they look like now because the swelling is there. And once that swelling settles down, then that will be great. On the other hand, if somebody says, you know what, oh, they're maybe just a little bit too big, then we say, hey, then they're probably perfect because once the swelling settles down, they're going to be just a little bit smaller. So having said all of that, I hope you understand that it's really important to choose a qualified and experienced provider. There are lots of techniques that require a really good understanding of facial anatomy, of lip anatomy, and a high level of skill. So do make sure that you are in good hands. There you have it, a comprehensive overview of lip fillers and various techniques to achieve those picture-perfect lips. Whether you are looking for a subtle enhancement or a complete transformation, there's a technique out there that can help you achieve your goals. I hope you found this really helpful. I hope you found this informative. And of course, if you have any questions or suggestions for future topics, feel free to reach out to me. That's it for today. If you want to contact me about lip filler for you or for somebody you know, of course, please do so, and I'd be happy to chat with you. Talk to you again next week. Have a wonderful week and take care.
Thanks for listening to today's episode of Anti-Aging Insights. Stay tuned to discover more of the latest news, treatments, technologies, and developments in non-surgical cosmetic and anti-aging medicine. For more inspiration, to access the show notes, or to book an appointment with Dr. Fisher, Dr. Frame, or any of the other anti-aging professionals, please visit our website at antiagingvancouver.com. Until next time, stay inspired and live life well.